Alright, so we're now past midnight, so this is fun. Gonna go back up here. Chapter 30, heart failure. Only one medication. I'm gonna do this one a little bit different because it's only one medication, but it seems like this is the most information heavy medication that we have on the list and all the things that we've been told that we need to know. So, what I'm gonna do is I'm gonna read certain things about it and then give a pause so you can say them back if you're watching, and then I'll read them again and then give a pause so you can say them back again if you're watching, and then I'll move on. And then you can go through this a couple of times to do some rote memorization, drive it all home. And then at the end, obviously, I'm going to go through why I highlighted what I highlighted. But first of all, we're going to talk about heart failure, left side, right side. So, right side, obviously, you're going to get edema in the periphery. Left side, you're going to get it in the lungs, okay? I think those are the two big things. She said they're not really on the slides, but I have written down right side and left side heart failure. Okay, so the drug is a cardiac glycoside. So, cardiac glycoside is the class. The drug itself is digoxin. Digoxin is a cardiac glycoside used for heart failure. Okay, so expected uses are management of mild to moderate heart failure in adults and children, control the ventricular response rate in adults with chronic atrial fibrillation. Again, expected use is management of mild to moderate heart failure in adults and children, control the ventricular response rate in adults with chronic atrial fibrillation. Okay. That's not highlighted, so. All right. Here's number one. Expected action. Cardiotonic or positive inotropic effect that improves the contractility and pumping ability of the heart by inhibiting sodium, potassium, and adenosine triphosphate. Decrease heart rate by stimulating vagus nerve and blocking AV node. I'm going to break that down Barney style now. So I'm going to say it, give you parts of it, give you a pause so that you can say it back. So, expected action of digoxin. It's a cardiotonic or positive inotropic effect that improves the contractility and pumping ability of the heart. Again, it's a cardiotonic or positive inotropic effect that improves the contractility and pumping ability of the heart. Again, cardiotonic or positive inotropic effect that improves the contractility and pumping ability of the heart. Next part. By inhibiting sodium, potassium, and adenosine triphosphate. By inhibiting sodium, potassium, and adenosine triphosphate. By inhibiting sodium, potassium, and adenosine triphosphate. So, first sentence all together. Cardiotonic or positive inotropic effect that improves the contractility and pumping ability of the heart by inhibiting sodium, potassium, and adenosine triphosphate. It decreases heart rate by stimulating vagus nerve and blocking AV node. Decrease heart rate by stimulating vagus nerve and blocking AV node. So the whole expected action one more time. Cardiotonic or positive inotropic effect that improves the contractility and pumping ability of the heart by inhibiting sodium, potassium, and adenosine triphosphate. Decrease heart rate by stimulating vagus nerve and blocking the AV node. Okay, let's break that down a bit, just so you can have a little bit to think about here. So the positive inotropic effect is basically, and that is highlighted in pink because it's something that was brought up several times during the lecture. I think that in itself is going to be used. So basically, it improves contractility. So it's allowing the heart to squeeze harder So more blood's getting pumped out, okay? But it also decreases the heart rate. So basically, it lowers the speed at which the heart's pumping, but lets it pump harder. Okay, so that's what that positive inotropic effect is. So again, the heart muscles squeeze harder, but it decreases the heart rate. So that's positive inotropic. That's definitely going to be tested. Um, so there you go. That's the expected action of digoxin. So she also said we need to know all of the adverse side effects for digoxin. So all of them. So I'm going to go through this once full speed and give it a pause, and then I'm going to break it down bit by bit, and then again, so the same way we did where you guys can, whoever's watching, can repeat. So adverse side effects for digoxin: PVCs, nausea and vomiting, anorexia. Anorexia equals toxicity, okay? Vision changes. You'll see yellow and green halos and problems with color perception, blurred vision, and mental changes, headache, bradycardia, dysrhythmia, and hypokalemia. So, I'll go a few at a time. So, first, adverse side effects: PVCs, nausea and vomiting, anorexia, which equals toxicity. PVCs, nausea, vomiting, anorexia, which equals toxicity. The next thing are going to be, we'll go with the mental changes and vision changes. So vision changes, you're going to see yellow and green halos and have problems with color perception. That's pretty unique, so probably pretty easy to remember. Vision changes, yellow and green halos and problems with color perception. Blurred vision goes along with this. Mental changes and headache. So again, vision changes, yellow, green halos, and problems with color perception. Blurred vision and mental changes and headache. Okay? And the last part, bradycardia, dysrhythmia, and hypokalemia. Bradycardia, dysrhythmia, hypokalemia. Bradycardia, dysrhythmia, and hypokalemia. All of the adverse side effects of digoxin together: PVCs, nausea, vomiting, anorexia, which equals toxicity, vision changes, yellow-green halos, and problems with color perception, blurred vision, and mental changes, headache, bradycardia, dysrhythmia, and hypokalemia. All right, so cautions and contraindications. There's a narrow therapeutic window. I'm going to highlight that because I remember her talking about it in class. So then severe myocarditis, ventricular tachycardia or ventricular fibrillation, strokes, and Wolff dysrhythmia. I know she mentioned those, but I don't see that in my notes of things to know. So, nursing considerations here: monitor for toxicity. Apical pulse. You have to check the apical pulse for 1 minute before you could administer this drug every single time. So, apical pulse 1 minute before you administer it. Digibind for toxicity, which is the antidote. That's why it's highlighted in blue. Anytime she gives us an antidote, we want to know it. And we want to have it on hand before administering. So digibind for toxicity, and again, toxicity is indicated by anorexia. Monitor potassium. Do not crush or chew capsule. Avoid over-the-counter meds. Eat sodium restricted and potassium rich diet with or without food, and do not stop abruptly. Okay, and then know the labs. I put this in red. She said the lab number is 2.4 or above. That's going to indicate toxicity. I don't know what the units are, so just think about the number 2.4. When you see this on the test and it's like, well, I don't know what toxicity is, it's 2.4. So again, anorexia is a sign of toxicity right here. Digibind is the antidote for if you have toxicity, and then the labs there are 2.4 or above for toxicity. Remember again, apical pulse for 1 minute. These nursing considerations are kind of jumbled, it seems. So again, eat sodium restricted and potassium rich diet, and then monitor potassium. If you go back up here to adverse side effects, hypokalemia. It's the only electrolyte that gets thrown off. So kind of look at that. And really that's it. I'm going to read through everything one more time, and then that's it for this video. So digoxin is a cardiac glycoside given for heart failure. The expected uses are management of mild to moderate heart failure in adults and children, control the ventricular response rate in adults with chronic atrial fibrillation. Expected action: cardiotonic or positive inotropic effects that improves the contractility and pumping ability of the heart by inhibiting sodium, potassium, and adenosine triphosphate, and decrease heart rate by stimulating vagus nerve and block AV node. Again, it makes the heart contract harder but lowers the heart rate. Adverse side effects: PVCs, nausea and vomiting, anorexia, which is an indicator of toxicity, vision changes, yellow-green halos, and problems with color perception, blurred vision, and mental changes, headache, bradycardia, dysrhythmia, and hypokalemia. Cautions, contraindication: there's a narrow therapeutic window, severe myocarditis, ventricular tachycardia, ventricular fibrillation, strokes, wolf dysrhythmias. All right, so nursing considerations: monitor for toxicity, know the labs, 2.4 or above. Digibind is the antidote. You have to check the apical pulse for 1 minute before administration. You don't crush it or chew it, and you avoid over-the-counter meds. You can take it with or without food, but don't stop abruptly. And then, again, because of hypokalemia, you want to monitor the potassium levels and then eat a sodium-restricted and potassium-rich diet. All right.